Hello. Many thanks for joining us on our discussion program, Focus Live. Week in, week out, we look at various topical issues that are germane to our daily life. My name is Kayode Taiwo, your anchor on this program, and today we are not going to look at anything so different from what the global attention is right now focusing. But we'll be looking at the impact of this global problem that we're having, health issue that we're having, the one that we've called pandemic at this stage, and that's COVID-19. We are assessing the impact. We are going to assess the impact in various areas of our lives that affect us either directly or indirectly. And we'll be looking at issues relating to tourism. We'll be looking at issues also relating to efforts of government at various levels as to the handling of this pandemic situation we have on our hand. And on the program today, I have already in the studio, I'm supposed to have two guests here, and I want to believe we will have the second guest joining us very shortly. I have the Honorable Commissioner for Culture and Tourism of Ogun State in the house with me here. Dr. Tony Taiwo is the Honorable Commissioner for Culture and Tourism. It's nice to have you join us.
Thank you very much.
All right. Well, let me start from the fact that we have just gone through the Easter break. Easter break used to be a time for people, fun seekers, travelers, tourist sites, visits, and all of that. You are in charge of that directly in the States. What was your impression in this this just past Easter in Ogun State in terms of tourism and visits to tourist sites?
Oh, thank you very much. Like we all know, what is happening all over the world? There is a global issue that is affecting everybody. Understand this COVID-19 is a pandemic issue, and it actually affected the tourist industry, not only in the state but globally. Understand, like you said, normally in festivity period like this, we always have people going to our tourist attraction center with their families and their loved ones. But in periods like this, because of the rule that has actually been spelled out by the federal government, and which the state government too has also aligned with, that we should stay at home in order to curb the spread of this virus. That is the reason why you found out that most of our tourist attraction center have been deserted. Of course, most of this attraction sector have been deserted. Understand? You know that the ministry has to do with people. The industry is always about people, the interaction of people, coming together of people. So if we have to obey the rule of the social distance, it means people have to stay at home. It means staying at home. So that's the reason why you find out that most of our tourist attraction center, there have not been any activities since the rule of staying at home and the order had been given that everybody should stay at home. That's the reason why you find out that Olumoro and some other places where normally activities have always been going around, we find out that people have not been going there, because we just have to make sure that we keep the social distance in order to curb the virus and the index from increasing in the state.
All right. Now, it's rather a situation that is neither here nor there, because of the fact that since there is limits to the number, the category of people that can move around, certainly social life is completely dead.
Yeah.
But as a commissioner in this field, in this particular sector, how far are you worried about the present situation?
Well,
I am actually looking at it from the economic impact, which your ministry will probably be one of the major ministries that would be affected in terms of the IGR.
Well, if we have to really consider it,
Yes.
it's only the people that are alive that can talk of want to do business.
Okay.
So if these are precautionary measures for us to make sure that we are alive, I think it's better for us to stay at home today, so that tomorrow we can still continue, to do our business. So it's actually affecting the ministry, because the area of tourists is only where we get our IGR. But because of what is happening now, we shouldn't even be talking of the IGR. We should be talking of the safety of the citizen, because the welfare of the people is also paramount, to us. We relate with the people, we interact with the people, so their welfare is much more important and it's paramount in this situation. So it's affecting us, but the issue is not about the economy now. The economic is affecting everybody. There is a global downtrend of economic all over. So it's not only in Ogun State. The whole world is having economic downtrend. But the most important thing is that we just need to obey the rule in order to curb the spread of this pandemic, particularly in times like this. Because if we stay at home and then we are at peace, it's better for us, to obey the government rule, to be alive, so that tomorrow we can do our business. It's affecting us, but there's nothing we can do about it.
Okay, all right. Now, I know that so far, since this pandemic has been on, particularly when the first index case was recorded in Ogun State, the state government has been on top of the situation with various efforts at putting palliatives across the people. Now, let's look at this aspect of government effort, particularly in Ogun State. Distribution of relief materials and all of that. We have had 1 week straight after the lockdown started. We are already in the second week. Today is Tuesday. By Friday, it will be 2 weeks. Now, in your own assessment, to what extent has this been really effective?
Well, the government of Ogun State has proactively reacted to the lockdown, because there were some palliative measures that were taken. Some stimulus were divided to the 20 local government, and then it's meant for the poor, the vulnerable, and then the aged ones. And then we've distributed it. Thank God for His Excellency Prince Dr. Dapo Abiodun MFR for his kind gesture at times like this. Of course, those are the steps to be taken, and everything it went on fine. The distribution was quite okay, though it can't go round, because it has been spelled out the kind of people that we actually want this stimulus to get to. You understand? So we are talking of the less privileged, the poor, and the vulnerable, and we have given it to them. You understand? So
now, yeah, looking at this present situation, we look at it from the angle of tourism. We must also look at the issue of culture. And I'm looking at the culture from the perspective of, we have some of our people that will tell you that if you combine this herb and this herb and this herb, it will do something. Don't you think that this cultural belief is also another side of what could be a negative trend in the effort of government at achieving this sit down at home and all of that?
Well, I would not advise anybody to want to handle this issue particularly these issues on their own. When we are talking of the culture, of course, it has to do with people's belief. It has to do with their attitude and their ways of life. But the health practitioners, understand, particularly the health sector, they've been creating a lot of awareness, telling people of what to do, the preventive measures. Understand, when you go out, make sure that you wash your hand. If you need to go out, put on your masks. And apart from that, they've also warned us that we need to wash our hand regularly. And if you are just coming out, you just need to make sure that your clothes are put out, and then make sure that your environment is very clean. So if you think because of your belief, you can now go and join one herb or the other, you are only trying to risk your life, and you've got only one life. So if you've got all these symptoms, it's better for you to quickly call out for help, because the issue now warrants that it has to be self-responsibility. You have to really respond if you need to leave, you understand, because nobody will know what is happening to you except you cry out. So, and I think the health sector, they've done a lot of awareness, and then there's a lot of advertisement that's been rolled on OGTV, you know, trying to sensitize the people, telling them of how to take precautionary measures and how to prevent the spread of this pandemic. So I think trying to do it on your own self may not be of any help. It's better for us to just make sure we follow the rules as stated by the health, the WHO and the health sector.
Okay, all right. It's still Focus Live, and we are looking at COVID-19, assessing the impact of the pandemic situation we have on our hand. And we'll be taking a short break, and by the time we come back, we'll be having our second guest joining us on this program, so that we can look at this topic holistically as expected. So don't go away, we'll be back shortly.
We are going to at least 500,000 packs, and this is based on the fact that we have about 5 million population in Ogun State, and we are working with about 70% of them may fall into this category. If you don't have yours yet, it's coming to you. But it is for the poor, the vulnerable, and the aged in our communities.
Rice, ẹ̀wà, gààrí, mẹ́ta yẹn ọ̀sọ̀ ìmọ̀gbọ́ ṣe nìyẹn nǹkan lórí nǹkan ètò.
Ọ̀tọ̀ wà lọ́rùn. Ìjọba ti ṣe ó ṣe àyẹ̀dẹ̀ wọn rè má ṣe oṣù wọ́n máa lọ sókè báyìí òkèlè lọ́ máa lọ ọ̀nì lọ́ọ̀lẹ̀. Ó tẹ́ mi lọ́rùn ọlọ́wọ́ ràn yín lọ́wọ́.
Ìjọba ló ní ká fún yín ọ̀bàdà. Wọ́n ṣe é. Èmi dákun ti lórí ẹ̀mí ọmọ akúra mi o. Ọlọ́run rẹ̀ lọ́wọ́. It is not a reward for voting. The reward for voting us in is good government, and this is what we are showing to people. His Excellency's government has promised his good governance, and this, I believe, is a very clear example of good governance, where we're supporting the poor and the indigent in our communities.
Welcome back. It's the Focus Live, and we're looking at COVID-19, and we are making an assessment on the program here today. Also joining us now is the Honorable Commissioner for Health in Ogun State, Dr. Tony Kuka, who has just informed me that all the while since morning, she has been doing a whole lot of talking. But perhaps she has no choice. The situation now revolves around our health.
Yes.
And you are most welcome.
Good afternoon.
Yeah. I'll also come back to you. Let me just allow you to calm down a little bit. Yes, we were looking at this issue of culture and belief earlier on, and I was trying to say that some people have this this thinking that they could manage this COVID using traditional ways. But looking at it, even though it's purely a medical issue that Orthodox are, you don't really think that the herbs could do anything?
For now, like I said, anybody that just trying to handle this issue on him or herself is only trying to risk his life. Because if the experts, even in the field of medicine, are saying that they've not gotten a solution to it, I don't see how somebody will now say that if I join one or two herbs together that doesn't have measure or doesn't even know the cure, that is going to cure the pandemic. You understand? You're only trying to risk your life. So it's better for us to just take to the precautionary measure and then be praying to God and looking at a way out. Because as I speak, there have not been a particular solution, you understand, to making sure that they get a cure to this issue, the COVID-19 issue. So if you say you want to use herb, or some people believe that if they take a lot of these alcoholic drinks, you're only trying to risk your life. Because the life is just one.
And it couldn't be an experiment?
Well, I wouldn't know if you want to experiment with your life, because the life is not, you don't have a duplicate. You understand? You've got only one life, and the only one you have, if you want to play with it, it's left for you. But the awareness is quite enormous that we should just try. Look at the death toll happening in America. You understand? Where we believe that these people who can actually handle it. You understand? As at this point, almost 23,000 plus. Understand? So if this kind of a thing is happening in an advanced country, where we believe that they should be able to handle it, talk less of we, the developing country. So it's better not to risk your life at all. So it's better to just follow the precautionary measure and take the preventive measure, and then praying to God so that we get a lasting solution to what is on ground.
Okay.
So I don't think anybody can say he wants to apply any solution locally now. For now, it may not work.
All right. Now, the Honorable Commissioner for Health, as at last announcement by the NCDC, Ogun State now has 9.
Yes, that's correct.
Confirmed figures. Now, I would like to ask you, looking at the proximity of Ogun State to Lagos, where most of these infected patients are moved to other states, and here is 9. Are there some other things that the Ogun State government is doing that actually is helping us out here?
I know that's a very interesting question, because that's the query that we've been querying ourselves in the Ministry of Health, to see that we've only got 9, and why is that? And my guess is, first of all, the way in which we quarantine our contacts. If you remember, if you think back to the first case, the index case, where all his contacts were actually quarantined in a particular location, and we ensured that they were isolated. They had single occupancy rooms where there was no interaction. So out of the initial 40, only 1 tested positive eventually, and they were all discharged home back into the community after 14 days. So that meant at the initial phase, we actually curtailed and contained the disease early, and there was any chance of community spread at that initial one. With the third case, it was also someone that returned from the UK and presented to a private hospital, where we were called in and we tested, and the individual tested positive as well for COVID-19. And in that instance, what we did was we went into that premises, contact traced all his contacts, and then stratify them into those who have accommodation arrangements that can allow them to self-isolate without interacting with others. The ones that we assessed that they could not self-isolate successfully and effectively, meaning that they're living in multiple occupancy rooms, like face me, I face you. So we made the decision to actually isolate them within the premises of that private hospital for the 14 days of observation, meaning that those people, if for whatever reason they were infected, they couldn't go back into the community and infect the community. That's how we've managed it so far. That might be one of the reasons that we're seeing this effect. But it also makes us wonder, because of our proximity to Lagos, why we are not getting that many cases, especially the border communities that border Lagos, like Moe, Ibafo, Obafe, Wode, and Ifo local government. But from the 9 cases, they're widely distributed across the 3 senatorial districts, and there's no particular pattern. However, the last 5 cases that we've had, 3 of them were people who lived in Ogun State but worked in Lagos, and they got tested in Lagos, and that was the reason that there was a delay in them updating our numbers for a few days, because they were actually accredited to Lagos because they had tested in Lagos. We've also asked ourselves that, are we not testing enough? But the case definition is very clear by NCDC that the people to be tested are people who have recent returnees that have symptoms, returnees, people who have had contacts with returnees, or individuals that have symptoms very suggestive of COVID that we can't explain. We've always, as long as we've had signals, we've had over 180 signals, which is queries that is this person, suspicious of COVID. We've gone there, and so far we've done 120 tests, and we actually have not picked up anyone that we've picked up 9 positive, but the others are negative. So we also are contact tracing. We have 210 contacts that we have traced. We've discharged 100 that we've actually observed for 14 days. At the moment, we still have 110 that we continue to follow up because of this recent 5. So we really don't know, but we continue to watch. What I do know is we got an epidemiologist to do a projection for us, the best case scenario and the worst case scenario. And at this point in time, this is our day 46. If 27th of February is our day 0, this is day 46, and we were expected from the best case scenario to at least have 85 positive tests and have about 9 people on admission, 1 on ventilation that's critically ill, and 1 death. All this has not happened. So I think we're doing well, and the gods must be on our side. And what I would encourage the people of Ogun State is to continue to observe the lockdown. It's benefiting us. We can see the results, and if you comply with this, we hopefully can actually see the end of COVID-19 disease in our community in a very short while.
But there's one worry I have coming from some of the things we do get on the field, and that's why when you get to some areas, the compliance level somehow is still worrisome, and that boils down to, it comes from the fact that some people still feel that, why are we not seeing, even if it is at a distance without the faces shown and all of that, some of these patients to really prove, because some people will still tell you, even despite the present situation, they will still tell you that no, all these things are scam. I don't know, what's your take on this?
So far, I think the paramount thing is confidentiality.
Okay.
The patient's privacy is very important, and we have a crop of patients in Ogun State that they're very conscious of their confidentiality, and putting them on TV is not, it's not in their interest. And if we so have a patient that is willing to have an interview and speak up, we will definitely invite OGTV to capture that in a documentary or in the news. But so far, I haven't had any of my patients, but contrary is what I get. I get phone calls that I was being talked about on the news today. You know, my information is not private, so I have to defend their privacy. And also, we don't want them to be stigmatized, because there are some stigmatization going on in the community. So we have to be well educated as a people that this is like malaria. It's deadly, but if treated, if caught early and treated appropriately, it does go away and the person can return into their normal life. So there is no need for people to hide away. If you've got symptoms, that fever, body aches, not feeling the cough, sneezing, call us. Even if you think you've got malaria, we're happy to test, because we want to increase our capacity for testing. This week, we've actually taken possession of a molecular lab that can test at least 100 samples a day. And by next Monday, we're going to take possession of another lab, which makes 2, that can test 1,000. But we can expand our capacity as much as possible, but unless people come forward. Places like South Korea that have been able to flatten the curve and now see a downward trend, what they've done with the lockdown is to test more people. More people came forward. What we don't know in Nigeria is, and in Ogun State particularly, is how many people have mild symptoms or are carriers of the virus that don't have any symptoms at all. We don't know unless people actually come forward and we get to test them. The test is free. It's at no cost to yourself. Give us a call. We'll come to your house and do it discreetly. Also, we have an app which you can get to on *723 *19 *2#, which leads you onto a form on the app that actually asks questions, and it would tell you if you are at mild risk, moderate risk, or you are high risk. The high risk will flag up on a dashboard in the Ministry of Health, and the state epidemiologist will follow up those cases. Also, we have the call center, where we have 100 people that are there waiting for you to call to help you and signpost you to the appropriate people. And the number for the call center is toll-free, is 0800 123 5678. You can call all those numbers, they're available to you, or even better still, if you want to call our epidemiologist directly, the number is 0818 897 8392 or 8393. All these numbers they're at your service to deal with this. Please do not hide away. Come out, let us test you, let's know what is the real representation within our community is, and by knowing that, we'll know what interventions we need to put to place. And lastly, the governor said we should always try and put, when you go out, we have 48 hours, every 48 hours we have a period of respite from the lockdown. We are to use our mask. That is part of our social distancing, maintaining the 2 meters, putting the masks on, and making sure that all the hygiene that we prescribe, washing your hands with water. Water and soap is the most effective way of getting rid of the bacteria. And we know that people transmit it from touching contaminated surfaces and touching their face and mouth or nose. That is why the mask serves 2 purposes. One is to prevent someone who might be carrier of the virus from contaminating you, and also you from contaminating yourself, because when you have a mask on, you can't touch your face, you can't touch your mouth. So you reduce your risk of catching the virus. So these are the things that we're encouraging people to actually adhere to.
All right. Now, I'm seeing some element of something that has to do with our culture in her submission. And that has to do with this idea of stigmatization. If we recall, some few days ago, the UK PM was also tested positive, and every bit of his treatment, when he was moved to ICU, we were told, when he was getting better and all of that. Now, is it not our culture that is also preventing so many of our people, even from coming out to say, look, I think I am having some strange feelings?
I think you're right, because like I've said, in UK, I understand those are in advanced country. They're always very honest. They want to make sure that they do what is right. But we've got a long way to go when it comes to our culture. It reflects in our behavior, in our attitude, and in the way we handle things. You understand? So it could actually contribute to it. Some people are just shying away from the truth. Some people felt once I'm tested positive, everybody will be running away from me, and the whole society will now tag me as if I'm an HIV patient, and it's not possible. You understand? It's not a death sentence. That thing is not a death sentence. It's just something like the Commissioner for Health had just said. It's more than like a malaria, kind of a thing that can be handled. You understand? So, and that's why you say we need to let our people get to know, a lot of all this. Some people felt, what is happening doesn't actually affect them. It's for the rich, it's for the high class people. No, it doesn't have class. This doesn't have class. It doesn't have to do with class. And as I will say, because I'm poor, it's not going to affect me, and I know what to do. You don't know what to do. You better just make sure that you stand by the rules, so that if you are alive today, you'll be able to do those things that you want to do tomorrow. Your life is more important. The basic thing about all these things, all these preventive measures and all precautionary measures they were trying to put in place is for you to be alive. It's for you it's for your loved ones to still be seeing you. That's the most important thing. You understand? So I think our culture has a lot to do when it comes to the aspect of stigmatizations and people trying to run away from you once you are confirmed, and that also buttressed the fact that the health commissioner just said that you have to keep all these things in private. Your privacy is more important to us when it comes to issues like this. So culture has a lot to do.
All right, I'll come back. Something comes straight into my head now, and that has to do with this 48 hours relaxation of. Some people have the opinion that perhaps we should just go a whole hog and fight this thing down straight away, rather than having to break where some people will still cluster in the markets and some other public places. So some of our reports even yesterday indicated that at some of the major markets you have crowds of people and all of that. Do you see this as not also a way of prolonging the fight to actually curtail the spread?
You've been talking about culture, and one has to be conscious of the culture and sensitivity around the community. Okay. In our community, a majority of the people actually earn their living day to day. And when you talk about well-being, I always say this, it's not just the absence of disease, which is health, but it includes the financial well-being, emotional well-being, and physical well-being. And to ensure that the people actually have something to eat, the palliatives that are being distributed are to the poor, to the vulnerable, and to the elderly. So you have a whole chunk of the society that are young, virile men that are not working at the moment. They have to expend their energy. So if they don't go out and fend for themselves every 48 hours, the tendency is they'll turn to other things. And that may end up as a security issue for the entire community. So the governor was very proactive, Prince Dakwa Abiodun was very proactive in actually anticipating this and thinking, you know what, we can't lock people up for 14 days. What would they eat? How would they earn? We will give them this, respite every 48 hours to go out, fend for themselves, make more money, buy some food. But whilst we're out, the directive is we must wear our masks, and also we continue to keep the social distance. And you should only go out if it's essential for you to go out. So people who don't have any business going out should stay at home. And the markets, definitely, we've spoken to the market women, and we've encouraged them to kind of find a timetable where not everybody turns up at the market. They can sort of alternate so that the crowding is actually eased around the markets.
Well, that looks like, just like you said, that our culture and our daily way of living might be an Herculean task for a situation like this. All right. I saw a report while you were also on the field, distributing the palliatives. What is your experience with people?
It's wonderful. I want to first of all appreciate His Excellency, President Dr. Dapo Abiodun, for taking that measure. What I discovered when we went out to the field was that we actually went into the remote. Some things that were going on social media, where we discovered that some people were trying to be against what the policy of the government, when it's not actually meant for them. So we decided to go by the instruction, to go to look for the poor, the vulnerables, and then the aged ones. So we went into the interior, and they actually appreciated it. They don't have a Android phone there where they can say they want to say. See, they appreciated it. They were all thanking His Excellency. They were all praying for him, praying for his long life, his family, because we went, into the interiors. We went to Ijofi, Tube, Idiroko, for Intedu, where those aged women are, and some of them really, they were really happy about it. They were really thanking His Excellency for this kind of palliative measures, the stimulus. They were so happy when we told them, you have rice there, you have beans there, you have gari there. They were like, even there was a particular case when I got there, I told the woman, the very aged woman, that I'm sent by His Excellency. He said, wow. I said, Governor. I said, wow, Governor to me. She was like, she can't imagine it, in the rest of her life. How can Governor just remember her? She was quite happy. She was very happy. You could see it written all over her. You understand that the governor is sending somebody to her. She appreciated it. She prayed for the governor, prayed for Ogun State, prayed for the administration and every one of us. It was a wonderful experience. It didn't go around, but then the ones that we have been able to distribute, it actually got to the quarters, and they showed their appreciation. And very soon, like we are hearing, another packages coming out, and I'm sure we'll still go to those other people that are in need, the people that are in their need of it. When you give it to somebody that you just say, what are you giving? It doesn't want it. So that's why we have to follow the instruction. Let's go into the interior, you understand, to make sure that the people that can't come out, the people that can't afford this thing, is the people that are actually getting this palliative. It's a wonderful experience.
Okay.
And thank God for His Excellency.
All right. Now, Honorable Commissioner for Health, I must ask you about those who work along with your ministry, the frontline officials, the doctors, the nurses, in a situation of this nature, that even the one who wants to take care of the patients himself or herself is also at risk. To what extent are these people really protected in terms of necessary, is it equipment, I'll call it, or necessary gear to wear and all of those stuff?
Thank you very much. Through the support of His Excellency, Prince Dapo Abiodun, we've been able to purchase PPEs, which are protective equipment of various levels. People think PPE is just the suit. It's not just the suit. PPE is a pair of gloves, is a personal protective equipment. A pair of the mask is a personal protective equipment. So we've graded how we distribute the PPEs. So for primary health centers, we've distributed sanitizers, gloves, and masks to every local government to cover those local governments. Also in our secondary healthcare centers, which are the state hospitals and the general hospitals, we've purchased over and above their usual requirement and distributed PPEs to them. And with the people that are actually working as frontline workers in the isolation centers with patients confirmed with COVID-19 disease, they have the PPEs that is appropriate for that setting, which is the suit, the gloves, the goggle, the boots, and everything they require. We've done that. Secondly, we have actually, through the support of the governor, we've been able to procure life insurance for them. Should they, for whatever reason, the course of their duty come to harm and end up having a fatality or being unwell, the life insurance will cover them and cover their family. And lastly, we look out for their psychological well-being, which is very important because the strain of actually looking after sick people for long hours, 12 hours a day, can take a toll on one's personal mental health. So we have mentors in the form of consultants that support these individuals, and I personally would normally check in on them to make sure that they're okay, things are going well with them.
All right. Now, okay, it's still Focus Live, and I want to say that you can be part of this discussion. The line is already on the screen. You can call us. Even if you have an information you want to even pass, the Honorable Commissioner is there. She will definitely respond straight away. And if it is just that you want to contribute to what we are discussing, you are also free to do so on the program before we round off the program. Now, this is is a global thing, but whichever way we look at it, we must also look at some specifics. Now, I don't know, Ogun State, for instance, to what extent has this really affected our activities? Whether we look at all the areas of our activities, from the health to education to all of that, to what extent?
Obviously, it's had a multi-sectorial impact. Firstly, it's the industry, which is what actually generates income. It's affected us economically because although we are the industrial hub for Nigeria.
Sorry, there's a caller on the line. Ezekiel from Ekperi. Hello. Okay, I think it's coming back. Please, if you are still there, you can just lower your television set so that we can hear you clearly. It's humming at us here. Anytime you want to call us, just roll down the volume on your TV set so that we can hear you clearly. You're making a point.
Yeah, so industrially, we've actually told all factories that are non-essential to close down. Those are the factories that pay taxes, that run the state. So it's had that financial impact on the state. Secondly, education. All our schools have been off for the last 6 weeks, and our children are being taught at home from home on the digit education, which occurs on OGTV, which is innovative. And thirdly, with the healthcare facilities, we've actually stopped all routine appointments and surgery. We only do the emergency surgery, antenatal care, and also immunization. We want to reiterate that the primary healthcare centers are open for immunization and routine antenatal care.
So we have another caller, Folonsho from Abeokuta. How are you, Folonsho?
I'm fine.
Yeah, good afternoon. Go ahead.
My own contribution goes on. Hello?
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 Yes. We're still having some problem with most of our callers. Okay, I think, please, whenever you're calling on a live program like this, just turn down the volume on your TV set, or you stay away from the television set and hear us from your receiver. We'll get you so that we can share whatever opinion, question, or suggestion you have for us. You can still call us back. We still have enough time to do this. Yes.
So the impact, as I said, is multi-sectorial. But one thing that comes to mind is the fact that I don't think we'll ever be the same as a nation. I think we need to look inwards into being self-reliant, because what quickly occurred to me is once the airspace was closed, we were struggling to get medical equipment. And things as simple as masks were difficult to get. But, they say, crisis, the crisis is the mother of invention. And we've been able to get companies, industries that are now making masks. We know over 1 million masks have been ordered by His Excellency, Prince Dapo Abiodun, so that even the tailoring departments in our hospitals, way back as 4 or 5 weeks ago, I'd already told them that, we can ration our masks the imported one for surgeons, and the other people working around the hospital, you can make the masks. So they started making their masks in the tailoring departments in the hospitals and giving 2 masks to each person.
That's also getting some people busy.
Yeah, so we're creating employment and being innovative. And I think this would not go away. We need to start promoting actually local content and using things that we can manufacture. There are people manufacturing this. There's no reason why an industry could not start making surgical masks locally. There are people making tissue, whatever fabric it is that they use, we can use it. So I think, and also working from home. A lot of people who work in banks and companies are now working from home. So internet service.
Okay, Ademi from okay, I think it's gone. It's gone.
Yeah. So actually learning to work from home, which a lot of Nigerians thought would be impossible. They are working. The roads are less congested, and I think going forward we'll probably have less congested roads because we've all forcefully,
So it's not all negative.
No, I see opportunity. For me, from where I sit, I see opportunity. The last thing that is done is actually helped us expand our capacity in our healthcare sectors. The equipment that we're buying and to actually prepare ourselves for COVID response is actually equipment that we can use long after COVID. So at the end of this, our healthcare would have been immensely strengthened. So for me, it's opportunity, opportunity, opportunity.
All right. Now, Dr. Taiwo, let's look at the global impact of this pandemic on tourism. To what extent do you think this has actually affected tourism?
Honestly, on a more serious note, it's having a negative impact on the tourism industry. I remember that the Secretary General of United Nations World Tourism Organization was actually lamenting that we're going to lose about 50 million jobs at risk on this issue, and that we're going to have a loss of close to 30 to 50 billion US dollar in this industry, because it's an industry that had to do with traveling, and they have to do with the tourists, the arrivals of most international tourists. So it's actually affecting us, and I think the WHO knows the importance of the industry. They came together on the 26th of February, to be precise, to have a meeting. A joint press statement was actually released by the 2 UN at Geneva, trying to tell people to please comply with what is actually happening. The WHO had to contact the United Nations World Tourism Organization, because they know that the people in the industry will understand their language better. You understand? So that's why when they contacted them, they had a meeting, and they all came to the conclusion that this pandemic need to be handled the way it has come, and we need to take this precautionary measure. And that's why you see most of the industry are now being closed down because of this pandemic, so that we can have a preventive measure of people not spreading it or transmitting it all over. It's having a global effect. It's having a global effect. Even on the arrival, almost 20 to 30% of the arrival of international tourists that we're expecting this year, which is almost 1.56 billion, is being reduced according to the new forecast by almost 20 to 30%. So it's actually affecting us. The airline, the industry generally is on the downtrend, if not totally down.
Now, we have quite a number of Nigerians in the diaspora.
Yeah.
Some are even trying to come back home. We also saw some, even though some of these things on social media, you can't take it to the bank because a lot of them are manipulated. Yeah. You don't get details. But all the same, we still have some Nigerians who want to come back home. Like some countries are taking their citizens out of this country. What's your take on this?
Well, my advice is for our own federal government to also make an arrangement if possible, to see how they can actually evacuate our citizens from those other countries. Of course, there are some rumor going up and down that they are being maltreated. I wouldn't know whether that is true or not. But if other countries are coming to pick their citizens, if we actually have the importance, if we know the importance of our citizens, and we know, like the Commissioner for Health have said, their well-being, if it's paramount in our heart, we should also make an arrangement of how to bring them down back to their own father's land. It's an opportunity for them to come back home. But once they arrive, the issue is that they should just be, quarantined for the 14 days and then given the necessary tests before they enter into the community. And that's the best thing to do. If they are clamoring to come back home, my advice for the federal government is to please find a way of trying to evacuate them and bring them back home. That's my advice.
Okay, all right. Dr. Okoka, now on some media, even at times when you read some journals and all of that, reports on this, the management of this COVID-19. In some cases, you see some people will say that, okay, with paracetamol and this and that, at least for those who probably for one reason or the other might not want to come forward, or even if they come forward, what are those basic things they can possibly do, at least to sustain themselves until they get proper Medicare?
Well, there's a lot of report out there. What I would say is for every infection, there is...
Okay, sorry, we have another caller. Roland, good afternoon.
Yes, good afternoon.
Yes.
Well done. On behalf of everybody, like country and state Nigeria.
Can you speak a bit louder?
I said I'm calling. There is some issue I want.
Hello, Roland.
I'm listening to you. Hello?
Hello, yes, go ahead.
Yes, there is issue on ground, like we are talking about our health issue and lockdown. There is issue on ground in the area of security. There are issues and areas in Ogun State now that they are terrorizing people's house on sleepless nights. Government and your president need to work on that. You don't need to let people see through doors and they are terrorizing them.
Okay.
You understand?
Yeah.
Area in Ogun State like Milaro now, there's an information leaked there that there are armed robberies taking place now. This broad afternoon.
You are saying some people are terrorizing the community?
Yes, exactly.
Where exactly are you talking about? Is it ongoing, or you are talking about the one that has happened?
It's going now, it's going in different corners. There are some communities that is not sleeping in the night. Just like this,
you want to give us a particular community?
Yes, one is the Abalabi. It was terrorized and threatening a community called Ajigule in Ilaro Express Road.
Okay, Abalabi.
Ajigule. Yes, and also, yes. Okay. And also, as now me and you talking, information gets to other village that is armed robbing case is going on now.
Yeah, Rola, thank you for the information you've given us. I'm very sure that
work on security.
Thank you. I'm very sure that those who are in charge of security are actually working on that. And if you monitor news, we'll also find out that the Inspector General of Police yesterday also deployed special intervention forces to Ogun and Lagos. And we want to believe that the situation is getting a little bit calm now. And but beyond that, I think it's all of us should be vigilant. All of us should be vigilant while we are coasting home. What would be your advice to people watching us on this situation, on how to cope with the impact of this lockdown?
I'll encourage everyone to comply with the regulations by the government with the lockdown, because it's in our interest, and the sooner we comply, the sooner we'll see the back end of COVID-19. The way to cope is be creative, use your time. For those who have craft, you could use your time to create things. You could paint if you like painting, you could sing, you could be helpful. There might be things that you've always wanted to do. Write a book. You could start writing your journal and start writing your book. There are many ways to spend the time. For me, this Easter, I had a few days just to be by myself, and it was constructive. I was able to think, clear my mind. Life is on a treadmill most of the time, and this downtime is actually not a bad time, because it's when you rest that your body starts to rebuild itself. So to overcome COVID, take this time to rest, build up your immunity, and we'll be ready to hit the road running when COVID is over. Thank you.
All right. And Dr. Taro?
I just want to give my advice that we should just yield to the instruction of staying at home, stay at home and stay alive. It's good if you want to actually enjoy yourself. There is a lot of time for us to enjoy ourselves, but it's better for us to obey the rule of staying at home and keeping the social distance. It's quite okay for us to make sure that this period, like my colleagues has rightly said, you make good use of it. You understand? If you are able to control your culture, you'll be able to control your life, because your culture reflects in the way you do things, in your attitude, in your behavior with the society. If you can control your culture, you can control your life. Thank you very much.
All right, and that's where we're going to drop the curtain on today's program, Focus Live. I have to thank my guests in the house, the Honorable Commissioner for Health in Ogun State, Dr. Tomi Koka. I know it's been a very stressful period.
It's okay.
Don't worry, it will definitely pass over. And I also want to thank the Honorable Commissioner for Culture and Tourism, Dr. Toyin Taiwo. I also thank you for coming around. And to you, viewer out there, that you are unable to get across to us today, well, it's just one of those things. Another opportunity will avail itself when I come again next week at this time on this channel. Until then, I leave you in the hands of Almighty God. Bye-bye.